the word global can have two meanings. One is really geographical. Global is the globe, the planet. So global health is something with regard with the globe. And some of the people say, yes, but global has another acception, another meaning, which is integrated health, personalized health.
Global healthcare has been the driving and motivating force of dozens of medical professionals for the past 10 years at the Geneva Health Forum, an event imagined in 2006 by the Geneva University Hospital and which has established itself as a major actor in the North-South debate concerning access to healthcare.
Souvent, on se retrouve encore dans des schémas quelque peu archaïques où il y aurait des personnes qui aident et d'autres qui reçoivent. Et, on reste encore un peu sur ces anciens schémas protectionnistes et je pense que le GHF a permis de faire sauter les dernières barrières, les derniers obstacles. En tout cas, il contribue fortement.
3 days of conferences and dialogue placing health for the greatest number of users on a daily basis all around the world at the heart of the debate. Global healthcare, which entails a necessary awareness of the importance of non-communicable diseases. That is the challenge that the organisers of the Geneva Health Forum have set themselves over the years, a challenge which is not always easy to meet.
It was quite a challenge to deal mainly with non-communicable diseases, because a lot of people coming to the Geneva Health Forum are people who still work in international health, some of them in tropical medicine, which up to now has been mainly concentrating on infectious disease.
As we speak now, non-communicable diseases contribute to half of all hospital admissions in the country and also contribute to about 40% of all hospital mortalities in Kenya.
My colleagues in Switzerland or in developed countries ask me, David, why are you working in diabetes in developing countries? And they think of it as a disease of the rich, which is unfortunately no longer the case. If you look at developing countries, I would say that you have specialists who are trained in Europe, in the United States, but their knowledge isn't adapted to the local situation. And I think what's important to realize is whether you're in Geneva or in Bamako, the challenges of diabetes are both very large, in that diabetes is not just giving people pills, it's lifestyle, it's diet, it's physical activity.
60 to 85% of cause of death in low and middle income countries alone is because of NCDs, chronic disease. So I think there's a shift, epidemiological shift, that's what we call, for the transition between vertical disease-oriented deaths and transitioning on to chronic disease burden, because lifespan is much more, but look, people are not living healthier. So that needs a change. That's why we need to make a change in our medical system education. We need to change our public health policies, our global health policies to accommodate that change. So coming from that perspective, yes, it's very important for medical students today to educate themselves about NCDs so that it can be effective advocates.
The Geneva Health Forum has also focused on highlighting certain issues for healthcare professionals and even the danger they face when exercising their profession.
I think what we see is that increasingly health is seen as a strategic policy area in which all the actors in a conflict try to manipulate and to use health as an element of combat instead of what has been foreseen by the Geneva Convention to see it as a space of neutrality and impartiality.
An aggressive behavior to respond without being afraid of our response, but sure.
Unfortunately, it's also a reality for us, not only in the field of humanitarian field, but also here in Geneva. We have some acts of violence on our own staff, and I think the main challenge is not to be led by fear, but to be led by professional responses, so that we can not only accept not the unacceptable, but accept that we live in a dangerous environment sometimes, and to provide professional responses for professionals. And there, I think we have to learn one another. Of course, it's not extreme situation like they live as humanitarian organization, but still, there are some quite, I would say, new paradigm with the violence that some people do to our staff that we have to take in consideration, be it at the end of the world or here in Geneva.
In order to better support healthcare providers all over the world, the Geneva Health Forum over the past 10 years has also relied on the sharing of knowledge and skills from all professional circles. A pooling of ideas and technologies aimed at the global healthcare sector.
Nous avons besoin de ces plateformes d'échange et de ces lieux de rencontre où vous avez énormément de nationalités et de milieux différents qui peuvent se retrouver pour apporter des solutions innovantes.
Being based in Geneva, which usually called one of the capital of health, where we usually have resolutions, big statements, global conferences on global issues, we thought that it would be interesting also to bring not only the policy element, but also the practice and how actually people who are involved directly in health programs worldwide can bring back their experiences and learn from each other.
What these people miss very often is a real sense of what's going on in countries. And the work which is being done in countries by many very good people, very knowledgeable and full of energy who want things to move forward, is very much ignored. It's in the grey literature or it doesn't make it through the global community. And it's extremely important to provoke that kind of debate.
I have met so many people, academicians, clinicians, and they all have their perspectives, and it's helping me a lot to explore, expand my vision to, improve the urban health condition in my country.
In 10 years, the Geneva Health Forum has become a major dialogue and place of exchange through partnerships and close collaborations with EPFL, CHUV, the STPH, the SSPH, the STC, the FOPH, the FDFA, and the Swiss Mission.